Hello, good morning, good evening, everybody. I'm Dr. Asavari Manvikar. I would like to welcome you all for CAR Global Webinar Research Series. Council for Ayurveda Research is an international non-profit organization based out of the USA, and it has its sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without the volunteers. So consider joining us as volunteer and we can place you in a variety of projects based on your skills and interest. Once again, our website is www.ayurvedaresearchusa.org. Now let me introduce our platinum sponsor, Komal Herbs. It's a company based in Pennsylvania. It is focused on the concepts of Ayurveda and the power of being healthy using herbal and natural products. Komal Herbals work hard to find premium ingredients for their herbal formulas. They also source herbs and spices that are sustainably and organically grown around the world. Now let me introduce our eminent speaker today. He is Dr. Narayan Shahane. We are really very fortunate to have him today. He has his expertise in Ayurvedic urology. Presently, he is running world's first and only Ayurvedic urology center, Brahma Ayurved, multi-speciality hospital, research, and academic center, Nadiad, Gujarat, India. He is practicing internationally in the field of Ayurvedic urology, especially in the management of the diseases of lower urinary tract like urethral stricture, bladder, neck obstruction, BPH, post-TURP status, interstitial cystitis, recurrent and multi-drug resistant UTI, hypotonic bladder, neurogenic bladder, and urinary incontinence since 2003 with a very high success rate without surgical intervention. He has received many awards and he has been invited by renowned institutions throughout the world. He has been invited by Canadian Ayurveda Practitioners Association (CAPA) and Canada India Foundation (CIF) and delivered a lecture on urology. He was invited by Japan Ayurveda Society to deliver lecture on urology in 42nd General Conference that was held in Osaka, Japan. He was also invited by National Ayurvedic Medical Association of Russia and delivered a webinar on Ayurvedic urology. He delivered various webinars at India's topmost renowned Ayurveda institutes such as National Institute of Ayurveda, Banaras Hindu University, All India Institute of Ayurveda, New Delhi, Gujarat Ayurveda University. He has been invited as a guest speaker and received Young Scientist Award in National Seminar on Recent Advances in Ayurvedic Science, organized by NASA. He has delivered a public talk in Malaysia on Ayurveda. He received Best Research Paper Presentation Award for his research on anorectal diseases by Ambumani Ramdas, Honorary Union Health Minister, Government of India, in the Second International Ayurveda Congress in 2005. So let me welcome you all. And now I would like to hand over it to Dr. Narayan Shahane.
Thank you, ma'am. Thank you for a wonderful introduction. So
Mhm.
let us start. So basically, first of all, I would like to really thank you, Dr. Asavari Manvikar ma'am, for inviting me for this session and giving me the opportunity to share my views on this specific topic. So let me share the screen, the presentation.
Mhm.
O Lord Dhanvantari, please shine something upon us so that we can reflect the world. So the topic we are going to discuss today is therapeutic spectrum of Uttar Basti as definitive treatment for lower urinary tract disorders and evidence-based approach. So first of all, welcome to world's first and only Ayurvedic urology center, Brahma Ayurveda, which is placed in Narayan, Gujarat, India. So before going to the actual topic, as it is really a very technical topic, so we need to understand certain basic things related to this topic. So the anatomy. Here you can see the male urethra is longer as compared to female urethra. Male urethra is around 20 centimeter long and female urethra is just 4 centimeter long. Urethra is a tube which carries urine from bladder to the exterior. Now regarding the physiology, actually bladder is a bag made up of a muscle, detrusor muscle. And at the base of the bladder, there are sphincters, internal sphincter and external sphincter, smooth muscle sphincter and external sphincter, which control the flow of urine. So basically, as long as almost 4 to 500 ml of urine is collected in the bladder, we never know about that. And once that limit is attained, we get the urge to pass urine. And as soon as we enter the washroom, we start the flow, the detrusor muscle contracts. At the same time, the sphincter, which is holding the urine, relaxes. So the contraction of detrusor muscle and relaxation of the sphincter is called as detrusor sphincter synergia. So this is normal physiological action of the bladder, and the flow starts. Now, as far as urethra is concerned, urethra is a very, very specific tube which remains closed for 24 hours, which is not a rigid pipe, which is very soft, delicate pipe which remains closed. It opens only when a person passes urine, and as the urine is passed, it closes again or collapses again. So basically, it is a collapsible pipe. So being a collapsible pipe, it has got its two distinct qualities. One is elasticity with which it can open up and close, and the other one is its caliber. Caliber means the maximum extent to which it can open up. And these two qualities are very much important for the normal functioning of urethra. Now, according to Ayurveda, it's very important to know, and it's very interesting that it is written in the text very beautifully, the physiology. It's like there is an energy which is called as apan vayu. This energy is really very crucial. So the description is as apano apanagah shoni basti metra uru gocharaha shukrarto shakrun mutra garbha nishkravan kriya. Means this particular energy apan vayu governs the physiology of semen, menstruation, stools, urine, and fetus. So the thing is, this particular energy is holding that particular thing up to certain limit, and once that limit is attained, the same energy expels it out. Like we know, like we were discussing, as long as around 4 to 500 ml of urine is collected in the bladder, we never know about that. Once that much urine is collected in the bladder, we get the urge. Means that apan vayu is holding urine up to that limit, and once that limit is attained, the same energy, same apan vayu expels it out, and the flow starts. Same with rest of the things, like same with semen. While performing sexual activity, this apan vayu is holding the semen, and once the limit is attained, the same apan vayu expels it out. Same with menstruation, like the innermost layer of the uterus, endometrium, is held for almost 28 days by this Apan Vayu. And once that limit is attained, the same energy sheds it off in the form of periods or menstruation. Same way stools generally for almost once or like we pass motion once or twice in 24 hours. So Apan Vayu is holding the stools into intestines up to that limit. Once that limit is attained, Apan Vayu expels it out. Same with fetus, like Apan Vayu is holding the fetus for almost 9 months. And once that limit is attained, the Apan Vayu starts the labor pain and the process of delivery starts. So, this physiology is very important as far as urine is concerned, and the restoration of physiology for patients is again very important because whenever a person suffers with some kind of urinary tract symptoms, there the physiology is disturbed and we need to restore the physiology. So one of the most important basics of surgery is to restore the physiology. That's why we have to discuss this. We have to understand this. Now, as we are working especially on the lower urinary tract diseases, so there are certain common causes of lower urinary tract diseases. And these are like, according to Ayurveda, these are Vegadharan, means neglecting the urges governed by Apan Vayu like urine, stools, etc. Vegodhiran means forcing the urges governed by the same Apan Vayu like urine, stools, etc. again. So one should never ever disrespect the urges nor ever force the urges. Then third is iatrogenic means instrumentation or surgeries on lower urinary passage. Then trauma, recurrent stones, urinary tract infections, unsafe sexual practices, and idiopathic means where no exact cause can be established. So the thing is, it is said in urology that almost 50% cases are iatrogenic, means resulted from some kind of instrumentation or surgeries on lower urinary tract. So this is very important to know. Now, there are certain specific symptoms of lower urinary tract disease, and they are called as lower urinary tract symptoms, LUTS. There are three different classes. The first is storage LUTS, means symptoms observed during the bladder is getting filled. So these are frequency, urgency, nocturia, urge incontinence, nocturnal incontinence, stress incontinence, incontinence, and pelvic pain. Then voiding LUTS means symptoms observed while voiding or passing urine, and these are incomplete emptying of the bladder, episodes of near retention, voiding small volume of urine, spraying or double stream of urine, hematuria means presence of blood with urine, burning and dysuria, straining to pass urine, hesitancy means difficult to start the flow of urine, poor flow, dribbling, intermittency. And the next class is of additional LUTS. The symptoms seen are hemospermia, means expression of blood with semen. Retrograde ejaculation means semen which should get out of the urethra. Instead, it goes to the bladder. That is retrograde ejaculation. Then discharge from urethra, reduced ejaculation force, pain in the scrotum or testicles. Dyspareunia means painful sexual activity, and fever, chills, and rigor. So these are certain symptoms of lower urinary tract diseases. Now, to treat all these conditions, definitely in Ayurveda, we have very specific treatments. And these treatments are like Uttar Basti, then calibration of urethra, bladder wash, then yoga karma or kalabasti, then yoga and pranaya, and certain oral medication. Now, we'll discuss one by one. So, the first thing, Uttar Basti, which is a highly specialized Ayurvedic urological procedure, which is non invasive with minimal or no pain. So, no need of anesthesia. Even usual catheterization is not required to introduce the medicine inside. It is a daycare treatment and proving to be a very promising treatment even today. There are certain special precautions which are really necessary while performing Uttar Basti, which are like rigid aseptic precautions and proper sterilization even of the medicine. So we'll directly observe the vitals, the procedure. So it's a normal thing that before performing any procedure, we need to prepare the part. Part preparation means we have to clean the area with an antiseptic solution. Then we have to drape the area So we have to cover unnecessary part with sterile drape or towels. Obviously, the procedure is conducted under very rigid aseptic precautions. So wherever possible, we use disposables like disposable syringe, etc. Rest of the things like instruments, they are properly sterilized with standard autoclave technique, including the dose of that medicine for that day. Even that medicine is sterilized. Here you can see a small adapter. It is called as Foley's adapter is attached to the syringe. It is a 60 ml syringe, disposable syringe. So we introduce it is almost 1 inch long. We introduce half of the portion into the urethral meatus, and then we gradually introduce the medicine. Now the process, the procedure of introducing the medicine should be as gentle as possible, as we are administering something against the natural passage of urethra. The natural passage of urethra is from inside out, and we are doing something exactly opposite to that. This procedure is absolutely painless. Yes, little discomfort is felt, but that can be managed. For that, we ask the patient to go for deep breathing, because deep breathing enhances or increases the secretion of endorphins from the cerebral cortex. And endorphins are naturally occurring analgesics or painkillers. Generally, we introduce almost 60 ml of the medicine. The whole medicine goes to the bladder, and from bladder, it works. In our center, we have treated patients ranging from the age of 8 years to the age of 92 years, and everybody tolerated the procedure well. So it's not painful at all. It's very important that procedure has to be conducted as gently as possible. Once we introduce the medicine, then we fix a penile clamp. We keep it there for 5 to 10 minutes just to keep the maximum concentration of the medicine inside urethra for 5 to 10 minutes. In case of females, we do the same way. Initially, we used to use center nozzle glass syringes to introduce the medicine, but now we are using the same Foley's adapter. So for Utar Basti, no catheterization is required. So there's no need to introduce a catheter inside urethra just for introducing the medicine for this procedure. Now the next one is to demonstrate the calibration. Calibration means, already we discussed that urethra has got its two distinct qualities. One is elasticity, the other one is caliber. So to restore caliber, we need to go for calibration. And the way it is done is like this. Initially, we introduce the medicine into urethra. Then we introduce uh, an anesthetic gel. Then we introduce different size disposable Eurocath. So generally we start with 10 French Eurocath, then gradually we increase the size, 10, then 12 French, 14 French, 16 French, 18 and 20. So when we are able to introduce 18 French catheter with ease, that means we have achieved the normal caliber of urethra. But still we introduce 20 French just to make sure that no fibrosis is left untreated inside. So in this you can see there is a color code. So this yellow is 20 French catheter. You can see like once we treat, generally we start calibration from 6th day onwards. So the medicine which we use makes the tissue so soft that you can see the catheter goes in very easily without forcing it in. And this opens up the urethra completely, and not only opens up, but at the same time restore the caliber of urethra. This is also absolutely painless. So for this procedure also no specific anesthesia is required, just that anesthetic gel is sufficient. Now whether Uttar Basti or calibration, as we are working on a very highly sensitive part of the body, so it has to be done as gently as possible, because vasovagal events are very common while performing Uttar Basti or calibration. That's why since years we are always keeping an intensivist standby, especially for the patients who are having comorbidities or aged patients. Now we'll discuss disease wise. Now the first disease of this area, which is supposed to be the most prominent disease of lower urinary passage, urethral stricture. As you can clearly appreciate, this is an ascending urethrogram. X-ray is taken while introducing that radiopaque dye into urethra. You can see the constricture. This is stricture here and one more here. So this is specific urethral stricture. So this is constriction of the urethra at certain point. This is urethral stricture disease. Now it's very important to know how the disease is formed, means the pathology. Basically, a stricture, the process of the pathology of stricture starts with a wound or ulceration inside urethra. Without a wound, a stricture would never form. So basically, whenever there is wound on any part of our body, that wound eventually heals and leaves a scar. So if you have noticed it properly, the scar left is much smaller as compared to the actual size of the wound. This is this is called as cicatrization of the wound or simply wound contraction. That means any wound contracts significantly, and this contraction is by almost 40 to 80%, which is a natural process. It is necessary, in fact, to heal the wound. So it's very obvious that in case of urethra is a very small pipe. If there is any wound or ulceration inside the urethra, when that wound is healing, that means at the same time that wound is getting contracted. So when the wound is contracted at the same time, the whole pipe of urethra gets constricted. So this is first part of pathology. So the whole pipe is getting constricted. This is how a stricture is forming. Now the second part. So in case of any wound, even in case of a deeper wound, when that wound heals, it heals from the base and it heals by granulation. Now, generally, when that granulation reaches to the normal level of the skin or any epithelial lining, the process of granulation generally stops at that level. Now, in case of urethra is a pipe through which urine passes many times a day. Urine is basically acidic in nature, it contains many salts. So, obviously, this salty acidic urine is disturbing this granulation each and every time when that person passes urine. So, the healing is disturbed. And basically, healing being a natural process, nature tries her best to heal that wound at any cost. And in that attempt, the rate of granulation significantly increases. And once it increases, it whether like ideally it should stop at the normal level of that epithelial lining. There is little overgrowth inside the lumen, and already the pipe is getting constricted, and again there is little overgrowth inside, like either in the form of mucosal fold or like this kind of, or this kind of, or this kind of. So this is called as hypergranulation or overgranulation, which is there inside the lumen, and thus the passage urethra becomes narrow. Now, this overgrown tissue or hypergranulation gradually turns into spongiofibrosis, which is supposed to be the actual scar tissue of the stricture, which is rigid. So, once it turns into fibrosis, it turns rigid. That means at that particular part of urethra, the elasticity is lost. Once it rigid, that means the elasticity is lost. Once the elasticity is lost, the caliber means the ability or the capacity of that tube to open up is also lost. And already we discussed that urethra is a pipe, which is a collapsible pipe. And these two distinct qualities of urethra are very much important for the normal functioning of urethra, elasticity and caliber. So both are lost. This is urethral stricture disease. Now, as far as the treatment is concerned, there is no specific or promising conservative treatment for this disease. So the next option is surgical treatment. The first option is of urethral dilatation. In this, under anesthesia, they introduce different size dilators. Generally, they start with a small size dilator like 8 or 10 French. Then they introduce next like 12, 14, 16, 18, 20, 22, 24, even 26 sometimes. This is also called as serial dilatation. Now, it's very clear that when they introduce the dilator, it is not going to enter in very easily. So they have to force it in. Once they force it in, obviously a new wound is formed because tissue breaks. And once the new wound is formed, again the process, the pathology restarts. And that's why generally stricture recurs within 1 year of urethral dilatation. And that's why generally urologists advise that patient to come for dilatation, and just to remind the patient, they post it near the birth date of that patient. That's why it is also called as birthday dilatation. Just to remind that patient that his
Mhm.
birthday, so it's time to go for dilatation.
Interesting.
Unfortunately, as it recurs frequently, that's why, and in fact, nowadays, only in government institutes generally they do dilatation. In like most of the urologists, they go for urethrotomy or VIU, visual internal urethrotomy, or direct visual internal urethrotomy. In that, they introduce scope, cystoscope or ureteroscope. Through that, they observe the constricture, and they, like, this constricture is there, and they cut it open to release that constricture, either using a blade, simple knife, urethrotomy, or using any kind of laser. Like, there are different types of laser available nowadays: holmium, thulium, carbon dioxide, diode laser. But again, while opening it, they have to cut it. When they are cutting it, they are causing a new wound inside. And again, when a new wound is formed, the pathology restarts. And that's why even after ureterotomy, generally stricture recurs within 1 year of the surgery. And most of the urologists, they advise that patient to go for clean intermittent self catheterization or self dilatation. They teach that patient to introduce a catheter to maintain the caliber of urethra after the surgery. But again, few things are involved with that. Like, for a normal person, it's very difficult to introduce a catheter the way a doctor does it in the hospital with that care. So there are two possibilities or complications involved. Like, while introducing the catheter, that person may introduce infection inside. The second thing is, being a blind procedure, that person may cause new injuries inside. In fact, it happens practically. Like, we have many patients, they came to us, like, we have recorded patients. That patient underwent first surgery for a small stricture, and after that he was advised to go for that self dilatation or self catheterization. He was performing it, and ideally that self catheterization is to be done like initially daily. Then that frequency has to be reduced to like alternate day, twice a week, once a week, fortnightly, monthly. But unfortunately, when that person tries to reduce the frequency, even the flow reduces. So again, he has to increase the frequency. Initially, they start with like maybe 18 or 16 French. Then they have to reduce the size of the catheter to maybe 14, then 12, and ultimately, like, maybe 1 or 2, after 1 or 2 years, that person has to go for the same surgery again. And that patient came to us after 3 surgeries within 8 years span. And initially, like, we have got all the three x-rays. Initially, that patient was having a small stricture, and when he came to us after 3 surgeries and 8 years of dilatation or self dilatation, he was a case of pan-urethral stricture. Means the whole length of urethra was constricted. So it happens. And generally, after going through 1, 2, or 3 urethrotomies, most of the urologists advise that patient to go for urethroplasty. Now, urethroplasty, in fact, urethroplasty is supposed to be the last resort for the management of urethral stricture. It is a major surgery and open surgery. In this, they open up urethra with an incision on the perineum, and the part which is constricted is excised, and that much part is reconstructed using buccal mucosa, inner skin of the cheek. So this is called as buccal mucosal graft reconstructive erythroplasty, BMG, reconstructive erythroplasty. But again, you can see that there is a big wound, in fact, a major wound. And because of the wound, the same process, the contraction of the wound, hypergranulation is there. And that's why even after erythroplasty, the stricture recurs. And that's why now we can understand. That's why it's very like believed in urology that once is a stricture, always is a stricture.
Mm.
And now we can realize that the results of conventional urological treatments are not really very promising. And the treatment of urethral stricture remains a challenge despite of those much advancement in urology. So what we do in Ayurveda, Uttar Basti, 20 settings for most of the patients, then calibration of urethra, and certain basic oral medication, Ayurvedic medicines. Now, I'm going to present some cases. Like, I would say the most complicated of case of my career till date. This lady, basically a Punjabi lady, but US citizen since long. She was suffering with stricture since almost 13 years, since 2001. And she has to undergo urethral dilatations every 6 months, or urine flow used to stop completely. Unfortunately, on 15th of October 12, she suffered complete retention of urine, and she has to undergo suprapubic catheterization in emergency. in California, USA. After a series of investigation on 17th December 12, she was advised to go for cystoscopy and vaginal flap urethroplasty in a blinded fashion, as she already underwent those much dilatation. So she was directly advised to go for urethroplasty. When they actually posted the surgery on 23rd of January 13, when they tried to introduce a pediatric trained French cystoscope, the smallest one, they could cannulate urethra for hardly zero point 0.5 centimeter. Then they tried to introduce a guide wire which is thin like the ball of a ball pen, but even with that wire, urethra was not negotiable at all. Then they tried to introduce the same guide wire through the suprapubic approach. Already the hole was there. But even through that approach, her urethra was not at all negotiable. And they have to abort the procedure. And they explained that lady that she has to lead rest of her life with this suprapubic tube only. Now, there was no hope because for most of the people, once the doctors of USA say that there is no hope, that means there is no hope at all. So what next? Then her daughter searched on the net. She got a site. The name itself is cureurethral.com. Then they communicated with us by filling this online consultation form. And actually, it was very hard for them to believe that an Indian doctor and that to Ayurveda doctor says that it is curable. How come? And we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied with the treatment. So ultimately, they came to us. We started her treatment 30th of April 13. Within 10 days, we were able to remove her suprapubic tube on 29th April 13 with normal urine flow. A lady who was unable to pass even a single drop of urine, that lady passed urine with a maximum flow rate of 16.8 ml per second. We should be at least 15 ml. Average flow rate of 12.4 ml. We should be around 10 ml, and that too without straining. Now, here it's very important to know that till today, it is very strongly believed in urology that it is simply impossible to open up a stricture without surgical intervention. And this proves that it is simply possible to open up a stricture with Utar Basti and calibration without a surgical intervention. So this is definitely very important to know that this miraculous statement can definitely do this. And not only this,
Absolutely amazing.
thank you. Not
Great
only this,
work.
but a lady who has to undergo dilatations every 6 months after completion of her treatment, she went to USA. After 3.5 years of her treatment, we treated her in April 13. She came back from USA. Actually, she came back to family wedding. At that time, also, she especially came to see us in December 17. After 3.5 years of her treatment, a lady who has to undergo dilatations every 6 months, she was leading absolutely normal life after our treatment for 3.5 years. And when she came to us, she especially came to see us. We did her uroflowmetry, and you can see even after 3.5 years, her urine flow was absolutely normal. And there's been more than 8 years she's leading normal life without any kind of calibration or treatment for urethrostricture. So this disproves the belief once is a stricture, always is a stricture. So both way, so a structure can be opened up without surgical intervention. It is possible, and even this disproves the belief: once is a structure, always is a structure. One more case. This guy from Maharashtra, a 65-year-old farmer, he also came up with the suprapubic tube. His urethra was completely blocked, as you can clearly appreciate in this ascending urethrogram. When the radiologist tried to introduce the radiopaque dye, it reached up to this point, but it didn't enter the bladder. There was completely impassable stricture. When the radiologist tried to introduce the dye little hard with little force, you can see the extravasation this way, this way. This is the extravasation of the dye, radiopaque dye. But still, dye didn't enter the bladder. So it was that tight stricture. Then we managed that patient, and here you can see the follow-up ascending urethrogram. The dye has entered up to the bladder with his, even the bladder is visible. Then we remove the suprapubic tube. The third case, this software engineer, basically Chennai based, again, he's also living in USA. He underwent his first surgery, cystoscopic surgery, visual internal uterotomy in November 11. Exactly after 1 year of the surgery, In December 12, he has to undergo second surgery. After exactly 1 year of that, in December 13, his flow reduced significantly. When he came to us, you can see in December 13, the max flow rate was only 9.3 with significant straining. After our treatment in December, that improved to 18.8 ml per second. And after that, he went to USA. He came back after 4 years, December 13, December 17. Even after 4 years, his Euroflow was absolutely normal. You can see 17.3, 18.8, without any kind of treatment or calibration afterwards. So again, this case again supports to disprove the belief once is a stricture, always is a stricture. We have managed many such patients. Like you can see, this guy underwent 3 surgeries, laser VIU, then underwent one urethroplasty in 2005. After that, stricture recurred and underwent 3 more laser VIU in 8, 9, and 11, then one VIU in 15, and one dilatation in February 16. And even after that, he was doing daily clean intermittent self catheterization or self dilatation. And even though he was following this, the self dilatation, the max flow was only 6 ml per second. So it was that bad. After our treatment in May 16, that improved to 16.5 ml per second, normal. And since then, he is leading normal life. So it's very important to know that in so the results of Uttar Basti. The first criteria is obviously ascending urethrogram. Before treatment, there is definite visual narrowing, and after treatment, you can see the restored caliber. Here you can see completely blocked urethra. Here you can see the dye has entered up to the bladder. And not only this, but the beauty of this treatment is here you can see the urethral lining is distorted. It is not smooth. But here it is just like a thin line. So it is absolutely smooth. The second criteria is obviously uroflowmetry and the mean Qmax means maximum flow rate. Qmax means maximum flow rate. So the mean Qmax before treatment, which we observed, is 6.3 ml per second, and after treatment, the mean Qmax is 21.7 ml per second. It should be at least 15 ml per second, the normal. So just I'm showing the image of one uroflowmetry. Here you can see the uroflow. The graph of uroflow is near to the baseline. It's very poor flow. After the treatment, you can see the way it has improved. You can see the date over here, 3rd of June 21st, 17th June. So within 14 days, the way it has improved without surgery, the max flow rate. So the mean Qmax before treatment for our patients is 6.3 ml per second, and after treatment it is 21.7 ml per second. Second criteria. The third criteria is American Urological Association Symptom Index Score. In short, AUASIS. So this symptoms index score has to be calculated based on these points. Like you can see here, if answered never, the point given is 0, less than 1 out of 5 times 1 point, less than half of the time 2 points, about half of the time 3 points, more than half of the time 4 points, and almost always 5 points. Like the symptoms are as follows, like symptoms over the past month. How often have you had the feeling of not completely emptying your bladder after you finished urinating? It could be 0, 1, 2, 3, 4, 5, whatever the like it is. Never 0. Less than 1 out of 5 times 1. Like if it is almost always, then 5 points. So we have to calculate the score for all these symptoms, like how often you had to urinate again less than 2 hours after you finish means frequency. Then third one is how often you found that you stopped and started interrupted flow. Then how often you found it hard to hold your urine, that is urgency. Then weak stream, then has to strain to pass urine, then nocturia. So all these uh, points are calculated and the score is calculated. So that score decides the severity. Like if the score is from 0 to 7, then the severity of symptoms is mild. If it is between 8 and 19, then it is moderate. And if it is between 20 and 35, then the severity of the disease is severe. So mild, moderate, and severe. And along with this, the quality of life is also decided. That patient has to quote the quality of life, whether it is delighted, pleased, mostly satisfied, mixed, mostly dissatisfied, unhappy, or terrible. So this is also very important while uh, assessing the patients. Here you can see the results of Uttar Basti as far as the AU, means the American Neurology Association Symptom Index score is concerned. The mean score before the treatment was almost 29.5, means the severity you can say is severe, and after the treatment is only zero point 0.5. It's very mild. Here you can see point 0 to 7 is mild, 8 to 19 is moderate, and 20 to 35 is severe. So before treatment it was definitely severe. After treatment is only zero point 0.5, is very mild. And the follow-up is taken for at least 1 year for each and every patient. Regarding the quality of life, the results of Uttar Basti, you can see before the treatment, the quality of life was, for most of the patient, it was either terrible or unhappy. After treatment, you can see immediately after the treatment, the quality of life was pleased and delighted. After 1 year, you can see it was pleased and mostly satisfied. Even after 2 years, it was pleased and mostly satisfied. It's not that each and every patient got cured completely. Some patients, for some patients, the symptoms relapsed after some time of our treatment. With symptom severity, you can see the relapse. So we managed total of 244 patients, out of which only 32 patients required additional settings, means that those 32 patients came back with relapse of symptoms. Rest of the patients are doing absolutely well. So for 32 patients, like relapse with mild symptoms, so 21 patients came back with mild symptoms, 8 patients came back with moderate symptoms, and 3 patients came back with severe symptoms. So you can see here the recurrence, so-called recurrence, the relapse of symptoms is only with 13.11%, and rest of the almost 84% patients, they are doing absolutely well, means they are leading absolutely normal life. Here you can see the success rate of Uttar Basti treatment, which is really significant. Then duration wise, relapse of symptoms. So out of 32 patients, the relapse of symptoms was observed within 1 year for 13 patients, means only 5.32% patients came back within 1 year. 7 means 2.86% patients came back within 2 years, and rest of the patients like came back after that. So even this is also significant. Now recurrence, again this is very important. Why recurrence? It's not that each and every patient came back with relapse of symptoms. The patients who came with relapse of symptoms, they were also very specific. Obviously all most of them were complicated cases, and they required additional settings of Uttar Basti. So the patients who underwent multiple surgeries, then after multi-stage hypospadiasis repair, then who were on regular clean intermittent self-catheterization since long, patients with BXO, is a skin disease of genitalia, balanitis xerotica obliterans, then post-buccal mucosal graft erythroplasty status, then patients of post-TURP, transurethral resection of prostate status, and who have very hard stricture scar tissue. Here the patient came back with relapse of symptoms. They were managed with additional 7 settings of Uttar Basti. In that, generally we do initial 3 days only Uttar Basti, fourth day calibration of urethra, and again 3 days of Uttar Basti. That's it. So even though they have to come back, we manage them with Uttar Basti and calibration. Again, no need of surgery. And after that, they are doing well. I'm going to present such case also. So this is a male patient, 48-year-old, underwent hypospadias APS. After that, he developed stricture, underwent first VIU in 89. After that, he has to undergo urethral dilatations every 3 months. After that, one more VIU in 98. Again, urethral dilatation for every 3 months. Again, third VIU in 2002. Again, urethral dilatation 3 monthly. Again, fourth VIU in 2008. And after that, the condition was so bad that he has to undergo whether either dilatation or calibration every 15 to 20 days. And each time he used to suffer severe bleeding, pain, UTI, fever with chills and rigors. So his life was like hell. Each time, like each after every 15 to 20 days, to he has to visit the urologist and undergo dilatation, and it was very painful. So he was really very much frustrated. His life was like hell. When he came to us for the first time in June 15, so you can see it is a very complicated case. A person who has to undergo dilatations every 15 to 20 days, that to that painful procedure. When he came to us in 22nd January 15, he came to us immediately after the dilatation. That's why you can see his flow was fine. It was 19.7 ml per second. So we managed him with Utar Basti 20 days course. And after that, you can see for the first time after his treatment, he was absolutely fine from June to October. A person who has to undergo dilatations every 15 to 20 days. From June to October, for 4 months, he was absolutely fine without any kind of treatment. Even in October, his flow was really good. In December, for the first time, he noticed the flow was getting compromised. Here you can see in December means after 6 months, his flow reduced a little to 9.1 ml per second. So we managed him in December 15. So a person who has to undergo dilatations every 15 days, his flow was fine for 6 months. Then we managed him in December 15. Exactly after 1 year of that, in December 16, December 15 to December 16, his flow got compromised again. So he was fine for 1 year this time. Then we managed him in December 16. You can see on 5th of January 17, his flow was again 25 ml per second, back to normal. After that, we observed him January 17, December 17, his flow was again normal. So even after 1 year, his flow was absolutely normal. So now you can see that for 1 year, it sustained. The caliber was maintained without any kind of calibration or treatment afterwards. A person who has to undergo dilatations every 15 to 20 days. And not only this, but you can see his latest urine flow on 11th of June 21st, this year, last month. His flow is absolutely normal. So January 17, since January 17, he is doing absolutely well. Means it's been more than 4 years. He is leading absolutely normal life without any kind of dilatation or calibration afterwards. A person who has to undergo dilatations every 15 to 20 days. Now he is leading normal life. So for that person, this is like miracle when he was suffering that much. Now he is leading normal life. So this is definitely possible with this particular treatment. Now each time, whenever we did follow-up treatment, it is of only 7 days without surgery, non-invasive treatment. Now one more condition, the post-transurethral resection of prostate status. So actually the TURP is supposed to be the gold standard for the management of benign enlargement of prostate. It is an endoscopic surgery. They introduce a scope and they just peel off the enlarged prostate, either using different instruments or even laser. But unfortunately, the outcome is not that promising. Though the procedure is supposed to be a gold standard, the outcome is not really very promising. And many patients suffer with bladder neck stenosis or post-TURP defect and urethral stricture. So I'm going to present one more a case of this post-TURP status. This guy underwent TURP on 29th of September 14. Then within 2 months, as stricture developed and he has to undergo cystoscopy and VIU, visual internal ureterotomy. Then he was advised to go for clean intermittent self-catheterization, and he was doing that, but still, like within 1 year, you can see the stricture recurred and he has to undergo balloon dilatation on 26th November 15. And after that, he was doing again the self catheterization. And even with that, you can see his flow was really very much compromised. Even with self dilatation, his max flow was only 4.2 ml per second. After our treatment, that improved to 14.6 ml per second, almost to near to normal, and since then leading normal life. So this is definitely a very kind of miracle for that patient. Now for this condition, again, post-TURP status, the Qmax, the mean Qmax before treatment is 7.1, after treatment is 18.2, and the EUASIS mean score before treatment is 21.4, after treatment it is around 4. Even you can see the quality of life, initially it was terrible or unhappy, but later, immediately after the treatment, after 1 year, even after 2 years, it is mostly satisfied. Yes, for this also, like we managed total of 36 cases of post-TRP status. Out of that, 8 cases required additional sittings. Out of them, 5 came back with mild symptoms. Then one came back with moderate, and two came back with severe symptoms. Rest of the patients are doing well. Duration wise, 6 patients came within first year, and rest of the 2 patients came after 2 years. So this is regarding urethral stricture disease. Now, two more conditions. One is bladder outlet obstruction. Actually, urethral stricture is a structural obstruction, and this one is a functional obstruction, a blockage at the base or neck of the bladder, which reduces or stops flow of urine. So basically, we discussed that there is a synergia detrusor. When the detrusor muscle contracts, at the same time the sphincter muscle relaxes and the flow of urine starts. This is the physiology, and this is called as detrusor sphincter synergia. But in the patients of bladder outlet obstruction, this synergia is disturbed. Means when the detrusor is contracting, the sphincter is unable to open up properly, and this is how it obstructs the flow, and this is called as detrusor sphincter dyssynergia. And the most important cause behind this is vegadharan, means disturb upon vayu. So varied amount of symptoms LUTS are observed, both storage and voiding. The treatment, the way we do is Uttar Basti, around 21 settings, along with that Yoga, Karma or Kal Basti as per the need of that patient, including Abhyanga, Svedana, Anuvasa, Niruha Basti. Then Yoga and Pranayam, certain relaxation techniques and certain oral medicines. Now this case, this guy from Australia, 23-year-old young chap, was suffering with this condition since almost childhood. In fact, the case is very interesting. He had an incidence of involuntary passage of urine in school when he was in fourth grade, fourth standard. So for a kid of almost 9 to 10 years, when that kid passes urine in front of everybody in the school, everybody laughs at that kid. So obviously that kid always cares the thing that he may pass urine at any time, anywhere. And with that fear in the mind, that kid starts holding urine as much as tightly he can. And that holding, Vegadharan, caused severe bladder outlet obstruction. So when he came to us, he was suffering with severe, like he has to strain a lot to pass urine with excruciating pelvic pain. And with that much efforts, he was able to pass hardly 50 ml of urine with significant post-wide resting. And the pain was so bad that he used to faint many times in the washroom. There were significant back pressure changes like bilateral hydroureter hydronephrosis, and he was suffering with constipation as well. He underwent many treatments at many like leading all the he visited all leading urologists, neurologists in Australia. Even he went to USA for the treatment. Each time he was advised to go for Botox injection in the bladder neck to relax the bladder neck or the bladder neck incision surgery. But the bladder neck incision surgery has got certain complications, especially the retrograde ejaculation is the most common complication after BMI. So for a young chap, unmarried chap, it was not advisable at all. And the Botox injection, botulinum toxin injection, involves many complications. So they were not ready for that. And ultimately they came to us. We started his treatment. Within 1 week, after 1 week with the treatment, like the way we discussed the treatment, Uttar Basti and Basti, That guy was able to pass around 100 ml of urine in one go without straining, without pain. And after 3 weeks treatment, he was able to pass around 300 ml of urine with ease. Then he was discharged. Actually, we call him back after 6 months for follow. So you can see when he came for the first time in December 12, the bladder capacity, the bladder volume was 17 and the residue was 660 ml. And there were significant back pressure changes, bilateral hydronephrosis, hydroureator. After 6 months, when he came in June 13, you can see the bladder volume after, actually he went there immediately after passing the urine, and the residue was only 50 cc, which was earlier 660 cc. And not only this, but the remark of the radiologist, the sonologist, very clear that the back pressure changes in upper urinary tract have significantly reduced. So this is very important. All these conditions which we are discussing, including urethral stricture or even this condition, they have no promising treatment in urology as of now. So the results of Utar Basti, so Qmax for this condition, the mean Qmax 6.1 ml per second before treatment, after treatment is 14.6, and the AUASIS symptom score, mean symptom score, initially it is 23.7, after treatment is 3.4. And the most important for this condition is mean post-wide residue urine. Post-wide residue. After passing urine, the amount of urine which is remaining inside the bladder is called as PVR, post-wide residue. So the mean PVR before treatment was almost 273.66 ml. And after treatment, it is only 38.16 ml. So this is very significant improvement. As far as the quality of life is concerned, before treatment, it is unhappy. After treatment, immediately after treatment, mostly satisfied. After 1 year, mostly satisfied. Sometimes it is mixed because it being a functional obstruction, even sometimes the stress affects this condition. So it is kind of psychosomatic condition. That's why it is mixed, but still, like either it is mostly satisfied or mixed, and they are doing well as compared to that unhappy quality of life before treatment. Now, relapse of symptoms. Out of 17, we managed 17 cases of intra-outlet obstruction. Out of that, only 3 patients required additional sittings, and 2 patients came up with mild symptoms, and 1 came with moderate symptoms, and rest patients are doing absolutely well. Now, duration-wise, out of 13 patients, only 3 patients came back. Out of them, 2 patients came back within 2 years, and 1 patient came back after 2 years. Now, this condition, interstitial cystitis or painful diarrhea syndrome or Hunner's ulcer or elusive ulcer. Again, this is a very, very nasty condition of this area. The symptoms are persistent urge to urinate. According to it is krute api akrut sangheta. So all the time that patient, in the mind of that patient, is that he has to visit washroom, and the frequency is sometimes up to 60 times a day. So it's that bad. That person has to visit washroom 60 times within 24 hours. And the urine amount is really very small. And whenever that person passes, urine is with a lot of discomfort, pain, burning. And the pain increases when the bladder is getting filled. And there is pain during sexual intercourse also. Now, case of this condition, a 58-year-old male, actually he's an industrialist from Mumbai. He was suffering with this condition since 4 years, and literally he left all his responsibility and he was at home since 4 years. He was managed at like one of the most reputed hospitals of Mumbai for this condition with intravesical cocktail therapy. In this, they introduce a cocktail of one anesthetic agent, steroid, and normal saline into the bladder, and then the patient is asked to lie down in prone position for a couple of hours. He underwent 5 plus 4 cycles, but there wasn't improvement at all. And when he came to us in September 16, his bladder capacity was reduced to only 117 cc, and he was unable to hold after that. And he was advised to go for augmented cystoplasty, which is a major surgery to correct the bladder capacity. In that, they use rectum to reconstruct the bladder. And then he came to us. We started his treatment with Utar Basti, Yog Karma, Kal Basti, Yog Pranayama, oral medication. Now here, this bladder diary is supposed to be a very important criteria to judge the patients of interstitial cystitis or IC. Here you can see initially the frequency was very high, and for the first time on fourth day he was able to pass around 210 ml of urine. When you can see the bladder capacity was only 117 cc, and fourth day he was able to pass 210 ml of urine. Means his bladder capacity was improving. Ultimately, at the end of the treatment, he was able to pass around 400 ml of urine. The patient whose bladder capacity was significantly reduced and who was advised to go for augmented cystoplasty, that patient was managed with this particular treatment, and bladder capacity reached up to almost 400, which is near normal. So this is possible with Ayurveda, and this bladder diary is authenticated by patient himself with his signature. So we managed him in October 16, and since then he is leading absolutely normal life. So for this condition, also for interstitial cystitis, the mean Qmax before treatment 11.8, after treatment 23.3, a mean score AUSIS initially it was 32.8, very severe, and after treatment it's only 2.8. Mean frequency of micturition during day before treatment half hourly, after treatment 2 hours 21 minutes, nocturia every half to 1 hourly, and after treatment it is only 1 to 2 per night. So this significant improvement is seen. Quality of life initially unhappy or terrible, after treatment immediately after treatment, after 1 year, after 2 years, it is mostly satisfied. As far as relapse is concerned, like we have seen, we managed 9 patients of this condition till date. Um, Now the 7 patients are leading really very good life afterwards, but 2 patients didn't respond to the treatment at all. So there wasn't even little improvement in their condition. Now out of 7, 1 patient came to us after 4 years, and we did some additional settings, and after that he is living normal life, and 6 patients are leading absolutely normal life. And it's very important that follow-up is taken for at least 1 hour, 1 year. Now the last condition we're going to discuss, recurrent UTI or multi-drug resistant UTI. In fact, this is the most burning issue of this era. This guy actually, his father of a doctor, was suffering with typical UTI since almost 2 months. Obviously, being father of a doctor, he was hospitalized and treated with local urologists, treated by local urologists with intravenous antibiotics for 15 days, followed by oral antibiotics for almost 1.5 months. Still, there was no significant improvement in his condition. When he came to us on arrival, there were significant lower urinary tract symptoms. He was also suffering with fever. Even when he arrived, the temperature was 104 degree Fahrenheit. So it was significant. In fact, it was kind of septicemia with hypovolemia. The blood pressure was 80/60. So for such condition, we manage it with bladder wash using Panchavalgal Quath, then Uttar Basti and oral medication we use. Rakta Medo Pachak Quath, there are total 9 drugs. Rakta Pachak, 5 drugs, Patul, Sariva, Musta, Patha, Katuki, and Medo Pachak, Kira, Tiktam, Amruta, Chandanam, Vishwabhishijam. So total 9 drugs. We give that 50 ml of Quath every couple of hours. Then Ushira Sav, 20 ml thrice a day before food, means Apankal. Then Samshmanimati, 2 tablets 3 times a day, and antipyretics SOS. So you can see the results, the way that patient responded. In fact, once we start the treatment, we stop all his antibiotics. When he came to us on 15th July, you can see the total count. The total WBC count was 20,180. Typical septicemia. Within 4 days, without single antibiotic, with Ayurvedic treatment only, you can see on 19th of July, the total count was only 6,610. So this is an excellent example for the people who believe that generally Ayurveda takes very long time for like correcting the disease. So here you can see within 4 days, that bad infection, the multi-drug resistant infection, was under control, absolutely under control. So along with this, we also manage hypotonic bladder, neurogenic bladder, incontinence, and all these conditions do not have promising treatment in modern urology. So the fact is, Ayurvedic urology, especially Uttar Basti, is proving to be a really promising, non-surgical, and quick treatment in this era. So, like few things regarding our institute. Like recently, I was invited in October last year by Ayurveda Society Japan to share views regarding Ayurvedic urology. Then a team of doctors came to us from Japan. Then I also visited Japan, the Ivory Pratishtanam of Dr. Hari Shankar Sharma and Dr. Hiroi Ramura Sharma in January 18. Then once again, another group of doctors visited our institute and they underwent uh, a practical crash course of understanding and application of basic principles of Ayurveda and Panchakarma at our institute. Then urologists from different countries also visited our institute to know what exactly Ayurvedic urology means. So this Dr. Garzi Nariman from Russia, an endourologist. Then Dr. Palaniappan Sundaram from Singapore, Dr. Ahmed Salah from Egypt, and Dr. Benamanatak Parinase from Algeria. We really appreciated the way we are working. A small introduction of our institute.
Welcome to Brahma Ayurved, Gujarat's first ever multi-speciality Ayurvedic hospital with world-class standards. Founded by Doctors Jui and Narayan Shahane, we have multiple theatres well equipped for urology, proctology, Ayurveda, and Panchakarma. For patients staying over, there are multiple beds, ranging from common to VIP, with special facilities. Guests receive excellent, healthy food and access to an on-duty doctor around the clock. Here you can receive the best of modern healthcare combined with the age-old wisdom of Ayurvedic medicine. We receive many local and international patients for highly specialized procedures such as the Utar Basti, an effective cure for urethral strictures, performed in our Ayurvedic Urology Center, the first and only in India. Brahma Ayurved. Follow the most authentic and updated science of life.
Thank you very much, everybody, for patient listening. And again, I would like to thank you, Dr. Asavari Manvikar of Council for Ayurveda Research, for inviting me and giving me this opportunity to present this particular, uh, like highly specialized branch of Ayurveda, Ayurvedic urology, in front of everybody. Thank you, ma'am. Thank you so much. Now the topic is open for discussion, and if queries are welcome.
You are most welcome. It was so nice to hear the work that you have done. Thank you so much for sharing those miraculous case results. And it was very, very informational. Thank you. So I see there are a couple of questions in the chat box by Dr. Rita Shah. Which medicine you are using for Uttar Basti? Have you decided, like, how do you decide the dose? And what have you given orally for those patients?
Okay. Like the medicines are different for different conditions, especially for urethral stricture. We have like we prepare our own medicines. Basically, there are four groups of medicines which we are using. The first group, basically, all are oil-based medicines. So the first group is of Lekhana Dravya Siddha Tel. Those medicines they help to debride that spongiofibrosis. So all Lekhan Dravya are there. Then second one is Vrana Shodhan Vrana Ropan. So combination of both drugs. Because now we know that basically an ulcer stricture is a non-healing ulcer. So we need to clean and heal. So Vrana Shodhan Vrana Ropan. Then fourth group is of Mutra Doshahara, which helps to heal the wound. At the same time, it strengthens. And the fourth one is Vasti Amayanta group. So all these medicines collectively, like they heal the ulceration, they debride the scar tissue of the or the fibrosis of the stricture. Then they heal the wound. Then they increase the elasticity of the urethral and paraurethral tissue, and at the same time they boost the immunity of local tissues by boosting the organism tissue barrier, which is the shield of immunity. And as far as oral medicines are concerned, for Uttar Basti, for urethral stricture patients, again we use the same combination of Rakta Medopachak Kwath, then urinary alkalisis like Ushirasau. For patients of bladder neck obstruction, we need to use like Shirbala capsules. Generally, we use Shirbala 101 Avarti capsules to strengthen, especially the pelvic floor muscles. And also, we use actually we give the name Apan Balak Shirapak, because we have to strengthen the Apan area, the region of
Mhm.
Apan Vayu. So these are the medicines generally we use.
Absolutely. Sounds good. So it's very scientifically based approach and using Ayurvedic, science along with the proper intervention. So this was absolutely amazing. Anybody has any questions? All right. So thank you so much for attending our webinar. Please watch and subscribe to our YouTube channel to view the earlier webinars and also the presentation. So we typically do this every month. There are 2 different webinars. So please like, comment, and share the videos. Once again, I really invite you to become a member and also fill out our volunteer form for Ayurveda Research.com. So you can now also subscribe to our IU update newsletter. So there is a newsletter that we send out to stay tuned to our projects and events. If you have any questions, feel free to contact us at Ayurveda Research USA at gmail.com, or you can also email me asavari@mnayurveda.com. So thank you again, everyone, and thank you so much, Dr. Narayan, for sharing your wisdom with everybody.